Hello, I'm Dr. Jonathan Amspacher, and I wanted to take a few minutes today to try and talk to you real basics about breast lift, or mastopexy as it's called formally. Breast lift is a very common procedure that a lot of ladies choose to undergo after they've had time in which their breast has started to sag or droop, which is frequently related to gravity, because we all know gravity, time, and aging always win, but we have a nice procedure that can help reverse some of the signs of gravity and aging. And so it's a very powerful procedure when done appropriately that helps lift and reposition the nipple on the breast mound and makes the breast look more youthful, perkier, and have a lot more pleasing appearance in many circumstances. Mastopexy can take several different forms. For people who need only a slight adjustment in the position of their nipple or areola on the breast mound, you can do a periareolar mastopexy. It just has a scar that goes around the areola, but this only allows for very limited amounts of movement of the chest and breast, and has the highest rate of return to previous baseline drooping, and so it's not as popular as the more powerful techniques, which are vertical mastopexy, J mastopexy, and Y's pattern or inverted T mastopexy. And so those are many different surgeries that are kind of based on the three different basic positions or types of scars that you can have. You can have an incision that goes around the nipple and areola straight up and down, an incision that goes around the nipple and areola and kind of J's out just a little bit of an angle at the bottom to the side rather than just being straight up and down, or a procedure in which you have an incision that goes around the nipple and areola straight up and down and then goes along the base of the breast at the bottom. And this is frequently called a Y's pattern or inverted T mastopexy based on where the incision is. And so those types of incisions are the ones that plastic surgeons frequently will use, and different plastic surgeons choose different incisions for different reasons. Most of the time it's the procedure that they're most comfortable with, in addition to based on what type of volume difference the patient needs made changed in their breast. If you need really large differences in volume, such as in a breast reduction, then a lot of the times inverted T or Y's pattern mastopexy will get you a very nice result. However, if you're taking off smaller volumes, which is usually the case in mastopexy, where you're just trying to lift the position, frequently a vertical mastopexy or a J vertical mastopexy are the types that we'll use in order to improve the size shape of the breast. Now, this can be done in conjunction or at the same time as breast augmentation, although we know that if you combine the two procedures, there's a slight increase in the risk. And so some patients will say that they can only afford to have one downtime, so they'll do both procedures at once. Others, wanting to have the safest outcome with the best chance with the lowest rate of complications, will split the two procedures up. And so it's one of those things you need to talk to your plastic surgeon about to see what procedure is best for you based on the things that you have in mind and what things you're looking forward to doing. If you have any further questions, please take time to look further on the RealSelf site and discuss it with your plastic surgeon. Thank you very much for your time, and best of luck on your journey.